This is a quick demonstration of how much time and money Passport Affordable Care Act management software can save you. You may download this cost calculator spreadsheet for free on our website. There are only 8 pieces of information required, so let's get started on the left side of the spreadsheet. It's fine to estimate, and you can even experiment with the numbers to see how the end result is affected. Number 1 is the hourly cost of your HR administrator. While we could just use their pay rate, payroll taxes, benefits, and other factors can significantly affect the true cost. We'll estimate ours at $34 per hour. If you have an entire HR department, you could even use an average. Field number 2 is the total number of employees. Easy enough. For this example, we'll say that there are 317 employees. The third field is the hours spent determining whether you are an applicable large employer. This is only done on an annual basis, and if you are very large or very small, the answer may be obvious. This is followed by the monthly hours spent tracking employee time. While central to payroll, the need for accurate and efficient employee time tracking is greatly reinforced by the IRS mandate to identify employees who fit their definition of full-time. Number 5 is the monthly hours spent reviewing full-time, part-time status on a case-by-case basis. Once you have identified all your full-time employees using the special procedures defined by the government's look-back method, you'll need to make sure that the coverage you intend to offer is deemed affordable by the IRS. Field 7 is the time it takes each month to make those offers of qualifying health coverage. This could mean sending out dozens, perhaps hundreds, of notices to the newly eligible. And the last entry field is the number of full-time employees under the IRS's 30-hour per week definition. If you don't know who these full-time employees are, we offer a free tool on our website to help you identify them. You should also note that if you have 250 or more forms to file, you are required to do so electronically. Preparing and submitting electronic 1095-C and 1094-C forms requires a software package or a specialized service. These filing services typically charge $2 to $3 per employee. Keep in mind that does not include any maintenance reporting or the necessary level of management throughout the year. Moving to the right side of the form, you can see that the labor costs and size of the workforce remain the same, but automation by Passport's Affordable Care Act management software greatly reduces the number of man-hours spent on ACA compliance. Using the number of employees previously entered, the spreadsheet estimates the initial time investment to get going with Passport's ACA. Next, choose the software version based on the number of full-time employees and whether you need multi-company consolidation. There is a modest annual fee covering updates that keep you up to date with changes to the law. Passport's ACA management reporting makes analysis quick and easy. Automation eliminates some duties completely. And for electronic filers, there is no surcharge. The software creates the submission files for you. And finally, we get to the bottom line, literally and figuratively. You can see that in this example, first-year costs are reduced by over 50%, nearly $6,000 saved. And the savings are even more pronounced in the following years, since you already licensed the software. Here we've saved over 90% in years 2, 3, and beyond. So download the free tool, crunch the numbers yourself, and see how much you'll save with Passport's Affordable Care Act management software. You may contact Marty at 800-969-7900, extension 103 for more information.